Really excited about this discussion. So again, welcome everyone to part two of our webinar series, Food is Medicine and Eating for Health. So thanks to everyone for joining us today. My name is Danny Nierenberg. I am president and co-founder of Food Tank. We are a research and advocacy organization really devoted to highlighting stories of hope and success in food and agriculture systems across the globe. And we do this with the aim to inspire, motivate, and ultimately activate positive transformation in how we produce and consume food. Today, we're going to talk about some really concerning issues, but some issues that have real solutions. And I just want to share some information with you. According to the Food is Medicine Institute, lack of good nutrition is the leading driver of poor health outcomes in the United States. And poor diets are the leading cause of death with Americans with lower incomes, living in rural communities, and from historically marginalized racial and ethnic groups. But there are solutions, as I said before. And during part one of our webinar yesterday, which you can watch on our Food Tank's YouTube channel, we had a great conversation about the systemic barriers to food and nutrition security and some of the solutions that can help us overcome these challenges. So we're going to dive into these barriers and additional solutions again today the solutions that can really help us build nourished, thriving communities. I now like to welcome Lindsay Waugh, who is the Executive Director of the Sprouts Healthy Communities Foundation. She's here with me on stage already. Lindsay, thank you so much for partnering with Food Tank. You've been an incredible collaborator, and we're really just grateful for this partnership.
Yeah, well, thank you so much for having me. It's exciting to look at the list of panelists that we have joining us today and also yesterday for really robust conversations that are addressing, this really important topic.
Absolutely. I'm wondering if you can talk a little bit about ways we can engage young eaters, especially early on, so that they remain, interested in eating in a way that supports their own health while building more resilient food systems. I think that's really at the heart of what the foundation does.
Yeah, I'd be happy to share a little bit about that. The Sprouts Healthy Communities Foundation is the philanthropic arm of Sprouts Farmers Market, which is a natural and organic national grocery store. And as we began our work out in the community 10 years ago, we wanted to think about places that we could be most helpful as we were looking at how to create opportunities for the community to connect with healthy eating, and to find ways that authentically brought that to life in ways that families and kids could, get excited about it. And so early on, we started working in the school garden space. And what I love about school garden education or cooking classes that are focused on working with youth is they help build age-appropriate skills that get kids building a natural, positive connection with healthy eating, connecting with fruits and vegetables. And so what is exciting to see is that when we get those kids when they're young, they start building what we refer to as access, knowledge, confidence, and desire. So those four things that they need to build those skills to carry into adulthood.
It's so exciting. I love that, it's not just helping kids learn how to cook or, learn more about fruits and vegetables, but that confidence factor, I think, is a really important part of this. Can you speak to that a little bit more?
Sure. When we think about um, any behavior change or anything that becomes a habit that you do over time, whether it's working out or, cooking at home, whatever that, skill as an adult, that same thing translates to children.
Right.
So when we get kids, feeling that they can look out at what they want to have for snack time or feel comfortable opening up the refrigerator at home and preparing their own afternoon snack or meal as they get older, what you're really doing is building that muscle memory. So that
Yeah.
way as you grow older and hit those additional milestones in life, you continue to build on that skill set. And so for us, what we get excited about is we've been doing this work for 10 years, and many of the organizations that you'll hear from today have been in this work even longer. But that's where you get that systems change, is when you start with the kids when they're young, and then they become, those adults that are practicing these same, skills.
Again, it's really, it's great. It's a great foundation doing great work. And again, I really appreciate this partnership. I'm curious, Lindsay, if there's anything that stood out to you yesterday that you heard from the panelists that you want to share with this audience.
One of the things that I think about a lot is, in today's world, how do we continue to lift up voices and perspectives and have conversations that bring in a lot of different people, that are looking at these same issues. And what I really appreciated from yesterday's conversation is we had this bridge between community, academics, organizations on the front lines, and that in the work happening at the government level with, Health and Human Services. And it was a really robust conversation. And so I think that for me, I consider myself to be a forever learner. And so being able to sit at the table and be part of a constellation of other organizations in this work, I think it gives us all a chance, to think about what is our role and how are we at the table to help advance these important topics. So I'm really excited to hear from today's presenters, and we'll probably be taking some notes along the way.
That's great. And I'll come back to you in a little bit, but I love that you're a forever learner. And it really is exciting to see this constellation of organizations really coming together on food as medicine. Thank you so much, Lindsay. Well, as I said, we'll hear from Lindsay again, but now I want to introduce our panelists. So first, let me introduce Sean Sherman, a Guala Lakota sous chef and the founder of North American Traditional Indigenous Food Systems, also known as Natives. We have Katie Garfield, the director of Whole Persons Care at the Center for Health Law and Policy Innovation at Harvard Law School. Tamra Ray Stevenson, who is the founder and CEO of Women Advancing Nutrition, Dietetics, and Agriculture, also known as WANDA. Radha Mathia, who is the CEO of the Capital Area Food Bank, and Devin Clattel, who is the Vice President of the Food Initiative at the Rockefeller Foundation. So welcome to you all. I'm always honored to talk to all the folks on this panel, because you're all doing such incredible work, and really appreciate you being with us today. I'm going to get started with you, Katie, if that's okay, because obviously there's a lot of uncertainty right now, especially in the United States, around what's happening at the federal level. Can you talk about what things look like for sort of food as medicine? And then maybe a little bit about, how in the absence of federal efforts or legislation on food as medicine, what can states do? So it's kind of a two-parter. Where are we and where could we go?
Absolutely. Happy to talk about that. So I think there's certainly a lot to say about the federal landscape right now. And to your sort of second point, it's deeply interwoven with what's happening at the state level. So it's almost hard to sort of parse the two apart.
Mm-hmm.
So I'm gonna sort of pull us back for a second, because I think it's useful to start with some context on sort of where we've come from and over the last several years in this space, because that's sort of important context to what might occur between that federal and state interplay. So I think what we've seen really over the last decade is, given the sort of great research and work of organizations on the ground in this sort of food as medicine and nutrition space, we, in reaction to sort of new data and new findings, we've really seen this great effort to expand access to nutrition support services, including things like medically tailored meals, medically tailored groceries, and produce prescriptions. And really the crux of that conversation about expanding access has been thinking about, how do we establish sustainable funding streams for these services, right?
Mm-hmm.
How do we move away from reliance on philanthropic sources and grants that may be time limiting, it may be limiting in who's able to receive them, and move towards long-term sustainable funding? And a lot of that conversation has really been in programs like Medicaid and Medicare. And so to give a really concrete example here, probably the most robust pathway that we've seen a lot of activity in over the last several years is the idea of Medicaid Section 1115 waivers.
Mhm.
And I'm sure we'll talk more about them on today's session, but these are really waivers that allow states to conduct 5-year demonstration projects. So think large experiments with new ways to approach delivery of Medicaid. So our public health insurance program that supports access to care for individuals with low income. And I'll say these demonstrations are used for all sorts of innovative approaches in the Medicaid program. But importantly for this conversation, over the last decade or so, we've seen states really start to incorporate coverage for nutrition supports. Again, things like medically tailored meals, medically tailored groceries, produce prescriptions into these waivers in order to really increase that access and get a really valuable evaluation of its impact. And so
Mhm.
at this point, we really have 13 states with approved waivers and 3 more with pending waivers before CMS that include nutrition supports. And so what I'm excited about at the state level is that some of these are starting to reach a point of actually getting results. So in the
Right.
last 2 months in particular, we've seen evaluations coming out of North Carolina and Massachusetts. And those evaluations are really starting to underline the positive impact of these services. So for example, here in Massachusetts, the evaluation that just came out regarding nutrition supports under our waiver was really showing an association between that policy and lower hospitalizations and
Mm.
reduced use of the ER. So good findings that are actually being repeated across states between Massachusetts and North Carolina. But coming back to your sort of first question, where does that put us right now, right? We are in a moment of just deep, deep uncertainty at the federal level. And in a lot of ways, right? We're in a moment when federal leaders, through things like budget reconciliation, are considering potentially seismic changes in programs like Medicaid, which could ultimately leave states with some really hard choices policy-wise across a whole range of issues in programs like Medicaid. So we're, of course, watching that because it will have implications then at the state level for
Yeah.
things across the board, including food as medicine. And then we're seeing at sort of the HHS and CMS level, again, some uncertainty, some mixed messages. So for example, we're seeing some real enthusiasm in HHS and CMS for thinking about the role of nutrition and health, which is encouraging. However, we've also seen some efforts to sort of walk back some of the progress that I was just talking about, right?
Yeah.
So we've seen a rollback of some of the really detailed guidance regarding things like the use of 1115 waivers and other pathways to support nutrition services and housing supports. We've seen the rollback of some funding streams that help states pay for that work. And so there's really policies cutting in sort of 2 directions, right? This enthusiasm for nutrition, but also some uncertainty about where they're going on some of the specific policy pathways.
Yeah.
And so the way I've been focusing on it is thinking about it as a bit of a tipping point, right? Where we could really see this momentum continue given that enthusiasm, but also some uncertainty. And so a real need to underline some of the great research and data that's starting to come out of the initial efforts.
Thanks for that. It is certainly, challenging times. Some of these seismic shifts that could happen are concerning. Food is medicine, and what some of the nutrition support services you described seem very common sense to me and should not be partisan. But I will see if that actually happens. Devin, if I can turn to you, Katie mentioned that we are at this tipping point. And I'm wondering how the Rockefeller Foundation is thinking about the role that states can play in food as medicine and some of the innovation that you're personally seeing from states.
Sure. Thanks, Danny, and thanks to Food Tank for hosting this conversation. I think it's really important with all of the sort of increased dialogue happening around food and nutrition to continue to lift up, as you said, what I think are really common sense, practical solutions, like some of the things Katie mentioned in her overview of, medically tailored meals and produce prescriptions and medical groceries. These are programs that are getting food into the hands of patients that are suffering in terms of their health because they don't have access to healthy food. And I can't really think of anything that's more common sense than that.
Right.
And at the same time, we know that when we're thinking about, shifting a whole sector like the healthcare sector towards thinking deeply about food and nutrition, we need good evidence, and we're going to need details and operating support and all these things to make these programs come to life. So some of the things the Rockefeller Foundation is doing, one thing is we're investing really heavily in the types of evaluation that Katie pointed to and research, and being able to document what I think a lot of folks on the ground already know about these programs, which is that they can help to improve health. They help to improve clinical outcomes across a range of conditions. They're often incredibly cost effective. We're increasingly seeing data that patients that participate in these programs, as Katie said, can avoid more intensive and expensive procedures or emergency room visits. So often we find that these programs are incredibly cost effective. And they also can have benefits beyond just the patients. Doctors and clinicians and providers tend to really support these programs. Patients rave about them, but they also can support households and communities. One of the areas that Rockefeller is investing in now is thinking about the link between food as medicine programs and local food producers and farmers, and how we can use these programs to support American farmers. So the benefits are diverse and deep and real. And I think part of what we're looking for from states in this moment is to, as Katie said, start to try these programs out, start to offer them at a bigger scale, capture the benefits and the data from those programs so that we can feed it back into the national conversation, so that we can help to educate doctors and providers about these programs, make more of the general population aware of them, but also just learn how to do them the best we possibly can. We know when really high quality programs are delivered to patients, we can capture all of those benefits. And so I think what we're looking for from states is to help us improve on these programs, help us to continue to build the case that this should really be an integrated part of the US healthcare system.
Absolutely. That makes me wonder, and maybe this is a question for both you and Katie and maybe Radha here. Why wouldn't states want to do this? Why wouldn't they want to be part of this sort of, evaluation process, putting these programs in place? Because the benefits are so big from what you and Katie both described.
I'll give a quick answer, and then I'm sure Katie will have a more detailed answer, and Radha too. This is a new muscle for the healthcare system, I think, in a lot of ways. The healthcare system, as we know, is incredibly stretched in this country, is made up of folks that are really busy. Doctors have a clinical workflow they're trying to stick to. Like, introducing a new type of program into that context is always challenging. And then, as Katie said, and I'm sure we'll speak to, like, we need to figure out the sustainable funding model, because right now that's not in place for states, and it's not in place for a lot of insurers across the country. And so figuring out how to make that funding model credible and reliable and sustainable, I think, will be a big part of getting states to try this out. The interest is there. I think states want to try it out. I think commercial payers want to try it out. At the Rockefeller Foundation, we have a partnership with the Veterans Health Administration. I know they're interested in trying it out. Folks want to do it. So I think it's a learning curve, and it's the sustainable funding piece.
Got it. Thank you. Katie.
Yeah, I would absolutely say ditto to everything Devin just stated. I think when we're thinking about this with states and stakeholders in states, the two big question marks tend to be, one, as Devin was saying, sort of what are the policies and how do we get there? So some of that is just helping states understand how they can use the tools that are already at their disposal, right? 1115 waivers are not new, but to Devin's point, it's sort of flexing a new muscle to think about how do we use that to support these types of interventions. And the good thing is we're seeing momentum around that. And as each additional state does it, I think it makes a little bit easier for the next state, right? Because they have more details on what that could look like. I think the other part of the equation is also infrastructure, right? Because so many of these food as medicine programs did start small, community-based, really thinking about philanthropic funding and things like that, they are also flexing new muscles to really integrate deeply into the healthcare system, right? So there's are needing to think about, okay, what does it look like to partner and contract with plans, with healthcare systems? How do I exchange data appropriately under things like HIPAA? How do I submit claims? And how do we reach all the areas of the state that we need to reach to make these policies really work on the ground? And
Right.
so that's also the other half of the equation. And again, I think we're getting there, especially as we see more successes and more sort of shared best practices in that way. But that infrastructure part also needs to be built up. And sometimes that takes funding and technical assistance. And so it's really a process.
I'm glad you
Yeah.
pointed out that we're getting there, but my concern is that, with the changes that are happening at the federal level, all of that good work will be wasted. Radha, over to you.
Sure. No, I just wanted to underscore a couple of things that Katie just said too, because these are very different types of partners coming together who haven't traditionally worked together before. And so that takes a little bit of time, both at the state level, where, Medicaid programs haven't really engaged with non-healthcare providers before, and now community-based organizations, cooperatives of farmers, et cetera, are coming into that mix, and that's different. So just an understanding of what each brings to the table, how each works, how we need to integrate is one piece of it. And the other is the systems and understanding this is privacy, of information, and we need to be careful about that, who has access to what. And then there's also there's the one way of the referral loop, which is fairly clear in terms of providers providing information to those who are providing some type of social determinant, in this case, nutrition. So that referral loop is reasonably clear. There are many different tech platforms. That's part of the issue, but the loop at least is fairly clear. But the return loop is not as clearly well defined, and that needs to be that needs to become a closed loop system. We need to know that this patient got a certain amount of food at regular intervals, and that information needs to come back into the electronic medical record system. So those are some of the things I think that still need to be worked out. But there's a lot of interest and there's a lot of collaboration. We just need to accelerate it.
Absolutely. Collaboration is going to be key. Radha, I want to give you a chance to talk from the food bank perspective about the sort of the demand you're seeing for healthy, nutritious food and folks who are coming in wanting to make sure that they have that access to healthier lives, essentially.
Sure. As a food bank, we have two parts to our mission. One is common to all food banks across the country, provide good, nutritious food to those who need a little extra help putting food on their tables. And we do that along with others. And 80% of the food we provide is good, nutritious produce, high protein, high fiber, et cetera. But then there's a population that is really focused on managing their current health outcomes or current health conditions, if you will. And so we've looked at some of the root causes of what cause individuals to be food insecure, and we see that it's lack of adequate health, lack of adequate skills to really facilitate that pathway out of their current circumstances to economic stability and then upward mobility. So we have seen in surveys that we do every year that the food insecure population suffers from chronic disease at twice the rate of the food secure population. And we know that of those chronic diseases, better nutrition can really go a long way in supporting better health outcomes. So as a food bank, we've really taken kind of a three-pillared approach to addressing this. So first is partnerships with all of the area providers, both big hospital systems as well as federally qualified health centers, about 4,000 patients strong, and sort of increasing the number who are enrolled in various forms of food as medicine programming, whether that's on-site food pharmacies or home delivered. And we've got research efforts ongoing, just as Katie spoke about earlier, to really show the impact, not just from a health outcome perspective, but from a cost perspective, to show that these are cost-efficient interventions. And then the advocacy arm is so important. We work across 3 states. Each of the 3 states functions a little bit differently. So really understanding how we can support those efforts to what we spoke to earlier, greater integration of various players. And the third piece gets to the sustainable revenue models, because we look at this as sort of a blended capital approach to how we would be looking at this. So in the beginning, yes, of course, it's supported by philanthropists who help us develop an evidence base to show the effectiveness from a health perspective and a cost perspective. Then our hope is to really bring in, through the 1115s and other mechanisms for Medicaid and increasingly Medicare and Medicare Advantage, to be able to look at reimbursing this. But we do think there's a time right now for private insurance companies to be able to look at those high-risk groups that for which they are, have high-paying dues members, to be able to define a cohort where they directly reimburse, because there's clarity that the implications of, good nutrition up front, it costs relatively little, and you see fewer repeated emergency room visits, on the back end. So it makes bottom line sense for everyone involved, the patients, the providers, as well as the payers.
Yeah, it's so common sense, and I wish we could see more of it. Thank you for all of that. Chef, I want to shift gears a little bit. We've been hearing, based on what we've been hearing, it's clear that we need solutions that operate, sort of at different levels and reach eaters in different ways. But one thing we need to make sure of is that there's a diversity of healthy foods available, including those that are grown by Indigenous farmers and business leaders. And I'm wondering if you can talk about the opportunities you see, while also acknowledging that Indigenous folks have created food as medicine. Can you talk a little bit about how, Indigenous business leaders and producers can be part of what we're seeing sort of take off now in the United States, at least?
Absolutely. I see so much opportunity for being able to utilize chefs and commercial kitchens to really help not only normalize, but start to popularize a lot more diversity in our food systems. And so our work was really focused on just highlighting, the diversity of indigenous foods in North America, especially the U.S., and creating systems to showcase that it was possible to open up, say, a popular restaurant that served only indigenous ingredients and cut away all colonial pieces, and kind of pushed away from the Eurocentric viewpoint of what's been normal for us for too long. So for us in North America, removing things like dairy, wheat, flour, cane sugar, beef, pork, chicken, and really focused on a lot of plant and protein diversity, and really kind of focusing on the health, but not having to call it a health food restaurant, for example.
Right.
But also realizing that restaurants are a privilege, because not everybody can afford to go to a restaurant. Restaurants cost money. So understanding that privilege is an important piece to how we've kind of structured things, because we use the restaurant as a tool under our nonprofit, because for us it's job creation and skill building, because we created over 120 jobs there, and we're building a whole new generation of skilled laborers around healthy indigenous cooking, and just what that looks like to the public. But we also are just moving into a new program, because under our nonprofit NATIFS, which is North American Traditional Indigenous Food Systems, our original goal was to set up kitchens so we could bring people in and train them how to cook healthy, diverse, regional, and culturally appropriate foods everywhere. But there were so many logistics to that, of just people not having money to travel, people not having time to get off of work, and so forth. And so we came across an opportunity, and we purchased a new building in Minneapolis, and we're opening up a new kitchen with a program called Meals for Native Institutions, which is creating a food model, a food production model, basically, where we're going to be moving into just doing what a lot of people are doing out there anyways. Because if you go to any rural school, especially in a tribal community, a lot of times they're stuck with an Aramark or Cisco, a US Foods, whatever products are coming through them. So we're creating a system where we're just making large format, ready to eat foods that we could freeze and ship all over the place. And we're going to be manufacturing those out of Minneapolis starting later this year. And basically, they're just these 5-pound food service bags filled with all sorts of different recipes, whether they're soups or sides or proteins or whatever. And we can, understanding the confinements of some of the dollars that have to go in there. So some of these servings have to be 12 cents. Some of these servings have to be 20 cents, whatever they might be, but also giving people the opportunity to add to them by utilizing some pieces like wild foods and plants and flavors that might be around them in their regions. Because it gives us an opportunity to really kind of think differently about how we're supplying a lot of the schools, hospitals, institutions, penitentiaries, community centers, anybody feeding large amounts of people. So instead of having to train every single chef, we can just create a program to make all these foods. And this model we're going to be replicating in Montana region almost immediately, because we're already expanding into the Bozeman region. So we'll be firing off these foods right away into 2 states. So right now I'm just fundraising like crazy, making this program happen, but it becomes a sustainable model, because the schools will be able to purchase these foods or find monies to bring those foods into their schools or hospitals or whichever direction it's going. So the kitchen itself will be sustainable with its workers of the money that comes in to support that. But the program is just something that I haven't seen out there quite yet. We're just kind of really excited to get this going. And that's the biggest opportunity I see is just like we can use chefs and kitchens in a different light to really just make the food happen, to normalize foods, because, you know, we should see more native foods out there and culturally appropriate.
Right.
It doesn't have to be just an indigenous silo. It could be any culture working towards these pieces, but really doing it with a semblance of health and really focusing on that.
It's so exciting. Congratulations on getting this off the ground in Minneapolis Minnesota and Montana. It's very exciting. Tambra, you know, Chef brought up a lot about the need for culturally relevant food and normalizing different kinds of food. You and I, nearly every time we're together on stage, talk about you know, often dietary recommendations or guidelines focus on one kind of diet, usually, you know, the Mediterranean diet. As the only way, right, to eat healthy, or it's often sort of, you know, positioned that way. But there are so many different diets, as Chef pointed out, that, you know, can contribute to health. Can you talk a little bit about what you've seen and why this is problematic, you know, especially for you know, Black and brown folks who are trying to eat healthy?
Yes, I would say in my nutrition training from Oklahoma State to even DC, most recently being a former fellow at USDA focused in nutrition research, seeing how it's one thing as an individual, be it an entrepreneur, to champion our cultural foods, but the role that policy and politics play in changing the system for addressing food apartheid is so critical to unlock the full potential of not only creating inclusive food systems, but really creating economic opportunities for all. And so that's why our work at WANDA is really looking at how do we play a role as an ecosystem builder in order to host and convene gatherings of folks to build that aligned agenda. I see my work in alignment with Sean, coming from Oklahoma, where we have both the contributions of indigenous culture and cuisine as much as African cuisine, and mixing and sharing the best of our cultures together in order to heal our people is so critical. And so we focus on how do we reclaim and reposition African diasporan foods as a vital evidence-based medicine. And that means foundations and agencies, as folks shrink from anti-DEI movements, is recognizing that health equity is critical if we're truly trying to level up America to reach a high level that WHO classifies as who is healthy in the world. And we're not ranked healthy. Why? Because unfortunately, racism has played an unfortunate role. Colonization has played an unfortunate role of not allowing the best of us be innovative in sharing all that our food culture has to offer. Mediterranean diet is not just the southern part of Europe, it's also Northern Africa and beyond. Having gone to Morocco and had so many tangines and Moroccan fresh mint tea, you can't say that was not healing. And so cultural credibility is bringing our chefs, our nutritionists, our food makers, our policy makers together, share our stories, create counter narratives, share the legitimacy that nutrition comes from other cuisines is critical, championing underrepresented superfoods like fonio and millet and moringa and okra and teff, and understanding that in order to address the diet-related diseases that we have in our communities is to begin unlock the human potential in the food systems. And so instead of shaming the soul food restaurant, retool, give the technical assistance, provide the continuing education so we can show there is a positive side of soul food being our medicine. Because the last I see living in Anacostia is not people dying from soul food, it's eating the ultra refined processed foods in the corner carry out stores that unfortunately is fried, diet laid to the side, and sharing that food that is not part of our culture, beans, greens, and whole grains, that is the essence of what we have known to eat. And community is medicine. So being able to eat at the same table and not be individualistic in our Western lens and how we see the food world is so critically important. And that's why this work that came from the Surgeon General in the last administration about loneliness was so important, that the antidote was coming around the table last November, ensuring that it's not just food is medicine, our stories are medicine. The things that we tell ourselves, just because my grandma and my mom have have diabetes. That doesn't have to be my legacy. And also, we should not be eating alone. So not only is bowling alone is bad, eating alone is bad, literally. And Mark Hyman, others have been speaking out about this, about loneliness. To have a physician to start speaking about the importance of loneliness tells you a lot, but there's a lot of strong data. And that's why my dissertation research is about belonging and Black women's health, because so many of our cities are being isolated. We saw that in the pandemic. And so to have food in the context of just medicine is limiting the full potential of our system. And that's why the culture and communalism must be a part of this, and creating those economic opportunities as what we have been sharing in the launch of our Lead Her program at Wanda, ensuring that when we build new levels of leadership within the food system, we will unlock the full potential of that system. And people can learn more about us at iamwanda.org.
And Danny,
Thanks
if I
so-
can just add to what
Please.
Tambra had said, the importance of culturally relevant food, so people don't have to change how they eat, but really get the support of critical foods that are part of their diets is so important. So we have looked across our area to look at what are the half a dozen or so major cultures, ethnicities in our region, and we track sort of the amount of food that we're providing into the community that fits those cultures' needs, that they themselves have told us they would like. So that, I agree, is just so critical. And to tie to the point earlier about local farms as well, there was a question in the chat about sort of high nutrient content. And that's so important, to be able to not only support local farmers, but to be able to influence what local farmers grow to meet the
Right.
needs of the community, to support them as well as to support the community. And so those are the kinds of things that I think are important, that so many of us on this call are looking at the whole larger food system, and how that supports food as medicine. We found that really important. And just an anecdote from one of our patients members who has lost 50 pounds, since being a part of the Children's National Program and our Food as Medicine effort in the diabetes clinic. And she's talked about, coming to this particular site of Children's National Hospital because it has the food pharmacy, and how her journey has helped her just appreciate, the sweetness of really good quality foods, as well as lose the weight. And because we provide food for the whole family, it's not just that individual who benefits, but the larger family. So to Tambra's point about community and the exponential effects of some of these programs as well.
Absolutely. Thank you, Radha. And I think to your point, looking at this holistically, really connecting the dots is so important. And I just want to, Tambra said two things that I think are important to remember. Our stories are medicine, and community is medicine. So Chef and Tambra, I want to come back to you both. How do we figure out ways to ensure that future dietary guidelines and labeling standards on foods can reflect the culturally relevant foods that we've talked about, and traditional practices of Black, Indigenous, and global communities, so that everyone's food, to Tambra's point earlier, can be recognized as food as medicine? Can you, Chef, maybe you go first?
Yeah, I mean, as far from the Indigenous perspective, we just really focus on, what is it going to take for us to be able to freely have access to our own foods. And a lot of what dictates us is sitting in the Farm Bill and really needs to be addressed, And so we really need to look at, especially when it comes to proteins and wild plants, and where we can harvest and when we can harvest, because land access is a massive issue still, of course, across the board in America and other places. But it's really hard to legally serve some traditional foods across all the different tribes all over the place, whether you're looking at Alaska or different parts of the US or Canada or even Mexico, And so, but in the US especially, it's just focusing on we need one of those steps to food sovereignty is having local control over our food systems and what we can and can't serve. And tribes should have the ability to be able to dictate what they can put in their own food systems, and historically, it's always been a part of the power grab of just dictating what foods we can and can't have. And so we need to work on changing those policies sooner than later, and the Farm Bill's been such a mess, it's hard to even get any kind of movement there, but that's what dictates a lot of what we can serve in schools and the hospitals and everywhere else. And it's obviously this doesn't affect just Indigenous peoples, but that's just, from our perspective, that's one of the biggest things that have to change. Because as sovereign states and sovereign nations with Indigenous communities, like there should be power there to dictate that, but it's still they're tied up with what they can serve in the schools and all those other spaces.
Thank you, Chef Tambra.
Yes, this topic is hitting home for me personally, professionally, as someone who research and priorities were shifted because of change of the administration of creating more culturally inclusive foods in our U.S. food composition databases. And out for those who want to geek out in nutrition science, the U.S. Compared to other countries in the European Union included, we have open source data when it comes to food composition data compared to EU. That matters because we have global impact when people use our composition data. That is the foundation of the dietary guidelines, our nutrition labels, our school buying guides. And so when we have a composition of foods that are not including Indigenous, African, and other foods included, it limits the full potential of how things are procured by the government. And also it shapes the not only research, but it shapes what comes out in terms of dietitians giving advice to their patients. And so some of the quick 5 strategies I want to share that we can think about in a system that may not be built for us is one is a community-led food documentation project. So having communities partner document their own traditional food recipes, and what we have been doing through our sisterhood suppers of encouraging people not just be oral people, but we must write our information because our information becomes data and that data turns into dollars. The other part is creating research partnerships with our historically Black institutions and Indigenous universities and global institutions of acknowledging that there are cultural informed nutrition profiles that we could be using, how precision nutrition can play a role, lab analysis, oral histories, but also advocating for policy inclusion and building that coalition force to ensure that the institutions and government must listen to us. We have not done that job of seeing ourselves as food citizens in a food democracy and championing for food policies. Marion Nestle understood it best that food inherently is involved in politics, and pilot food as medicine programs that feature diasporan dishes. The work that we're doing is how do we build that ecosystem of more women to see themselves in the food as medicine space. And lastly, for us, looking at how do we create our own cultural food composition archive and open source that data for others to use, and how the role that AI can play into help mapping and translating and standardizing that data. So we launched a food Black food census in the piece I did for Eating Well, which I'll drop in the chat, around African heritage diet, how Black food can heal the community. And I think if we continue to, again, push the narrative and counter the mainstream narrative and show other viable solutions, that is not enough to be the policy maker, the media maker, the food maker. We also must be the data collector and analyze the data, because that data is foundational to the work in science.
Thank you. Thank you both so much. Devin and Katie, I want to turn back to you. And I mean, we've heard throughout this conversation the need for looking at things holistically, the need for partnerships and collaboration. So Devin, you mentioned the work with veterans before that Rockefeller is doing. And I think, that's a very important relationship, because folks don't, a lot of us don't realize that there are a lot of veterans struggling with food insecurity. And then Katie, I know, the work that you do is sort of inherently built on collaboration and relationships. And so I'm wondering if you can both sort of speak to why that's important, especially in the food as medicine work. So maybe Devin, I start with you.
Sure. Thanks, Danny. Yeah, as I mentioned at the top, we have a partnership. Rockefeller Foundation has a partnership with the Veterans Health Administration, which is one of the largest integrated health systems in the country. It serves about 9 million veterans who unfortunately also suffer with a lot of diet-related conditions and food insecurity. And we've been working with the VHA for a couple of years now to provide food as medicine programs at different VHA sites. We just recently announced an expansion to 5 states. We're hoping to reach 2,000 veterans with our expansion to 5 states. And I would just say, we've talked a lot about whole person health. Of course, the veteran community is a community that cares a lot about whole person health. And I think to Tamara's great points, thinks a lot about community and the community amongst veterans and social connection and mental health, and the way that all of those things also connect to physical health and diet-related health. And so it's been really fantastic to work through that partnership, working closely with the VHA's Food Security Office to think about how we can add these benefits to the kind of suite of benefits that veterans already receive. And the feedback has just been incredible. I had the opportunity to spend a few days with some vets in DC last month, and they were telling their stories and just how much it brought choice to their lives. Like, we're talking about choice, how much it brought access and choice to their lives, how much it brought social connection to work with others in the program and go to the teaching kitchen. But also just how much it enabled them to feel like they were able to take control of their health in some way and do something for themselves. And I think it's been really fantastic to see that. While I have the mic, Dan, I just want to speak to one other thing that I'm seeing in the chat, if you don't mind. A lot of questions in the chat around local procurement and kind of the procurement of food for Food is Medicine. And I just want to say, I think that is a really important part of Food is Medicine and the outcomes we're trying to achieve if we do it well. And I think the best Food is Medicine programs think about benefits for the health system and benefits for the food system. And I'm encouraged to see, and I'm sure Katie can speak to this at the state level, but a number of programs that are starting to build in local food procurement and healthy food procurement and kind of procurement from small farmers as a part of the Food is Medicine policy or kind of program design. I'm happy to put in the chat. We've supported a number of organizations that are really at the forefront of trying to innovate around local procurement and health outcomes being integrated and blended into the same program. And like, if we make progress on Food is Medicine, but we're just reinforcing the entrenched unhealthy food system that we have, like, that's not going to be real progress for this space. I think part of building a new market is an opportunity to build a market that can support people health and planetary health and a healthy food system and healthy farmers. So I just thank you to everyone that's making those comments in the chat, because I think it's important to keep lifting that up and just know that there are folks on the ground that are really centering that piece of their program.
Thanks, Devin. I'm listening so intently to all of you that I haven't now I'm looking at the chat. Katie, over to you. Partnerships, collaboration, so important for the work you're doing.
Well, I just want to double down on some of the points Devin was making. I mean, first of all, Food is Medicine and nutrition and all of this, it's inherently a team sport, right? It really needs sort of investment at all levels and energy directed towards it from across the healthcare team as a starting point, right? Our physicians, our nurses, our community health workers, our registered dietitians, like across the team, there needs to be sort of investment in focusing on this issue, working together and getting these services to individuals. But then there's also, of course, the community-based organizations and nutrition organizations that then are partnering and are making that investment in building the new infrastructure they need. And then the states and the plans that really need to be making the choice that, yes, this is a critical way of improving health and therefore a good strategic investment. But what I think is sort of newer to the conversation and Devin's bringing out, but I love as an extra layer to this team, right, is thinking about how do we then connect that all to sort of our food system, right? So what is the role of growers, of local retailers, of all of that in connecting to this Food is Medicine work? And I've been really encouraged to see that as some of these policies are developed, that now we're starting to see some efforts to directly build that into the system at a higher level, at say the state level. So good examples of this here, we talked a little bit earlier about these 1115 waivers, these big experiments at the state level. We've started to see some states weave in language about local food producers, local organizations, when they're talking about who ought to be providing those services. So Hawaii is a great example here. When they submitted their proposal to CMS to have an 1115 waiver, they really incorporated language about encouraging the inclusion of local community-based organizations to support the purchase of locally grown food and strengthen Hawaii's intrinsic food system, right? And so that's a really interesting piece to bring into the conversation at really the policy level. And we've also seen similar efforts in states like Michigan. So Michigan's taking a slightly different policy pathway. It's important to recognize there are a lot of opportunities for states to think about this. Some are doing 1115 waivers. Some are thinking about things like what's called in lieu of services, which is sort of a wonkier pathway that goes through Medicaid managed care and is also really exciting. The main thing you need to know is that it's just another way to think about incorporating these services into Medicaid offerings. And what Michigan has done as it stood up its in lieu of services program is to actually, for policy guidance in that program, require at least 30% of nutrition services provided under the pathway to be provided by locally based providers, right? So I think that's how we're seeing that trend that Devin is talking about at sort of the organizational level, now percolating its way up to states and start to get built in fundamentally into these approaches.
It really is such an exciting time, and we've talked about this earlier. The opportunity is really big and right now, and so we don't want the changes that are happening across the country to put any of this in jeopardy because it is such an exciting time, and it can, you know, the momentum can help so many people, and I want to thank you all for sharing your thoughts and you know, the work that you all are doing. You all are heroines and heroes in doing this work. So thank you for that. I want to bring Lindsay Waugh back in our final few minutes to talk a little bit about what we've heard. But thank you again to all the panelists. You're all amazing. Thank you. Lindsay, we've heard a lot, and I know that, you know, the idea of you know, collaboration, partnership, so important to the work that you do, that network of that constellation of organizations and the networking that you do. What I'm wondering, you know, how you think about, you know, partnerships in this particular space around food as medicine.
Yeah, thanks, Danny. Before I answer that, I want to thank the panelists and also shout out to the really robust conversation that was happening on the chat. So many of the folks that are tuning in weighed in with really thoughtful questions and sharing about the work that they're doing at the community level. So just so you all know, we see you, we've been watching you. As panelists, we've been following along. And that's why Sprouts is involved in this work. You know, as a retailer, there's a different lens and perspective that we also bring into this conversation. But I think the thing that we can do right now to be most helpful is lifting up these conversations and then asking the question of what role can we play in authentically being at the table as a partner in this work as well. And so on one side, it might be through the nonprofit organizations that we're working with, but the other side of it is how we can use our megaphone to lift up this work and help to promote, again, those different perspectives and voices. A couple things that I took notes on that really stood out to me are Katie's comment about this being a team sport and it being a cross-team effort. And I just really appreciate that in this moment, that we really are seeing a space for everybody to be at the table. When we did the panel yesterday, one of the speakers used a term that I really appreciated, and she talked about everybody's a part of the food system, and whether you're, you know, growing food in your backyard, you're going to your local farmer's market, you're paying attention to the dollars that you spend when you go grocery shopping in a retail space. Each person has a say, and she used a great example yesterday. She said, you know, even if you have a basil plant that you're growing in your window, but you take those leaves off and kind of put them into a meal that you're making at home, you know, that's also connecting with the food system. And so when we look at this, it's we all have a chance, right, to think of ourselves as part of it. And you don't have to be, you know, an expert in it. I think we're all kind of dancing in this space where we get to connect with food. And then the other thing that stood out to me from today is, you know, Tamara made a beautiful comment about loneliness. And we can't just turn food into a conversation that becomes a tactical prescribed way that we're thinking about nutrition density coming in. We really have to look and say, what does it mean to be at the table, to connect with others, particularly as you look at those communities that are isolated, and how we're using food as a bridge builder and a way to revitalize and continue to share around culture.
Food as a bridge builder. I love that. Lindsay, can you share maybe a call to action with our viewers and listeners and, give them a to-do?
Oh gosh. I think it's been a theme throughout each of the panels that we've done. And what I would say is every little moment that we have in our life is a chance to connect and think about the intersection of food and our everyday lives. And so I think that just dismantling some of the trepidation people might have, or like a feeling of like, what do I do? It's such a big topic, and really just starting to take those small steps for how we engage, how we look around, how we collaborate. I think that would be a great call to action. And then there were a lot of really wonderful share outs, everything from things that are happening at the federal and state level, work that's happening, hyper locally. And so I think just, all of us finding ways that we can tap into that and help share.
Absolutely. Thank you so much, Lindsay. And thank you to the foundation for making sure that we could do these webinars, and we look forward to partnering with you a lot more. I want to remind folks that this conversation and yesterday's conversation is available on Food Tank's YouTube channel, so you can go there and watch again or share it with other folks in your network. I also want to thank the Food Tank team, including my co-founder, Bernie Pollock, our content director, Elena Seeley, and our events director, Kenzie Wade. They made this all possible and made sure that everything was smooth. And I want to thank all of you who have been watching today and putting such great comments in the chat that I'm just now having a chance to catch up on. But I love that everyone is so involved. So thank you all again. Be well, and we'll